Hello everyone. In this video, we will talk about pemphigus, a dermatological disorder. We will talk about this video in four contents: introduction, clinical features, diagnosis, and management. Let's start with the introduction. Pemphigus is a chronic autoimmune skin disorder which is considered to be the most treated, dramatic, and devastating of all dermatology disorders. Means pemphigus is chronic, means it's not acute, it's for the longer time. Autoimmune skin disorder means it involves the autoimmunity and which is considered to be most dreaded, means fearful, dramatic, and devastating of all dermatology disorders. The variants of pemphigus are pemphigus vulgaris, vegetans, foliaceus, and erythematosus. These are the four histopathological variants of the diseases in which pemphigus vulgaris is the most severe form. The clinical features are: it is commonly seen in jaw and predominantly affect adult but no sex predilection. It means it can affect both men and women. Bullae of the varying size are seen on skin and mucosal surface. On skin, bullae are so tense. On mucosal surface, bullae ruptures immediately to form ulcer and erosion. Nikolsky sign is positive. Ashby-Hansen sign is positive, and desquamative gingivitis is commonly seen. What is Nikolsky sign? Lateral pressure applied over apparently normal skin or mucosa causing sliding of the skin. Ashby-Hansen sign. It is also known as bullae spreading sign. When we apply pressure on bullae, it makes bullae spread. Means when we apply pressure on bullae, it will spread over the oral mucosa. How to diagnose a pemphigus? Diagnosis is made based on clinical signs. Histopathologically, the presence of intraepithelial bulla is characteristic of pemphigus vulgaris. Positive fluorescence under fluorescent microscope. When we add some fluorescence, it will show the colors in fluorescent microscope. Other non-specific findings are raised ESR, erythrocyte segmentation rate, and hypoalbuminemia. Management. As pemphigus is more dangerous, the mortality associated with untreated pemphigus vulgaris is 10%. The systemic corticosteroids are effective, like prednisolone 0.5 to 1 mg per kg per day is administered. Cyclophosphamide is given at initial dose of 50 mg per day and the dose is accelerated up to 100 mg per day. And mouthwash like benzidamine hydrochloride 0.15% helping in managing pain. Antiseptic oral rinses like chlorhexidine gluconate 0.2% is given. If you like our video, please subscribe to our YouTube channel at Explain Dentistry. You can visit Telegram channel for notes, Explain Dentistry. We also have Instagram ID, email ID and website. Join us at Explain Dentistry. Thank you very much.